It's Dr. Centeno, and today we're going to go over a knee level 1 basic topic, which is suprapatellar knee intra-articular access under ultrasound. So you use this injection to get quick access to the intra-articular space. Examples here would be just an intra-articular PRP injection or an intra-articular bone marrow or other cytokine injection when you're not trying to access a specific spot, but you just want to get into the knee in general. So the anatomy here is pretty simple. Really, you've got the synovial membrane that surrounds the joint, and you're taking advantage of the fact that the joint is like a little balloon, so to speak. And you're going to be focusing up in here. So you're going to place the ultrasound probe just above and lateral to the patella, and you're going to come in on long axis with the needle from lateral to medial. So this lateral suprapatellar site is really an easy site in most patients who have some sort of small effusion. Now, if you don't see a small effusion in this area, and I've got my probe there again, just above the patella and lateral, then you can ask the patient to contract their quad to try to bring out some fluid. And if you can't find anything there, have them contract and look at a secondary site just lateral to the patella. So moving your probe down from where it was before to try to find that lateral recess and use that as your target. Okay, so a critical skill obviously is going to be finding that suprapatellar pouch to inject into. I'm going to show you how to use quad contraction if there's no obvious area of effusion noted, i.e. if you don't see a pouch right away. We'll look at a primary area to inject, which is a superior lateral to the patella. And then we'll look at go hunting for a secondary area, which is sometimes there, lateral patellofemoral. So let's cue up this little video. Contracted, have the patient keep it contracted. I'm going to look around, and just above the patella, if I go any further down, I'm going to start seeing the patella here. But just above the patella, if I keep it contracted, again, that's the patella, and that's just above the patella is where I can find my reliable pouch. So you can see the reliable pouch right there, easy to see. And if I let go, the pouch will mostly go away. And you can see the two synovial tissue planes moving on each other as I do that. So in this case, again, I am moving to just imaging the patella, and then just above the patella is where I'm finding that reliable pouch while the patient has their knee contracted. So just above the patella laterally is where you can usually find something. If I can't find anything there, I can go further down. So I'm moving from the top of the patella here further down to the side of the patella, and now I'm imaging the patellofemoral joint here, and I can contract and relax and try to see if I can get any fluid to occur. So while I'm keeping contracted here, I'm moving up and down, superior and inferior, and there's nothing really there other than if I go further laterally. Watch as I go further laterally. Here is the patella. I come further laterally, and I can see a pouch right there. So that's another option for me to inject, is to hit that pouch right there. This is where my my probe is. So I've gone downward and laterally, and I've found a pouch with the knee contracted right there laterally to the patellofemoral joint. So that's a plan B. Now, what if you can't find any pouch? You can't find any fluid collection that looks obvious in which to inject into. You can try to find an obvious tissue plane that is intra-articular, and you do that by having the patient contract and relax their quadricep, and you should see the tissue planes above and below this move differently. Now this is a bit more advanced, as sometimes it can be hard to tell if the injectate's going into the pouch or into the surrounding synovium, but here's how you would identify that in this little video. That defines an area in the middle where you can try to go after and define a suprapatellar pouch as more of a potential space. Step 2, inject lateral to medial with the patient supine. I'll show you a video of how that's done, but you can see it here being done in this video. Patient supine, your lateral. This is, I will outline here the suprapatellar pouch, and then you can see the needle coming in from the right. And you want to double check the location, and the way to do that, there's two ways. One is to make sure you're infiltrating into a space and not into the surrounding tissues. If you infiltrate in the surrounding tissues, it's going to be painful. Generally, if you're just injecting inside this intra-articular suprapatellar pouch, it's not going to be that painful. Another way is to look for this air sign. So I have it here on the top left image there. You can see the suprapatellar pouch. On the bottom right, you can see some air that just got in the image there. So the air is right here. It's right on top of the pouch. And that tells me that I'm in that space at the beginning of the injection, and it'll also happen at the end of the injection to make sure I'm still in that space. The beginning of the injection will be the air in my needle. The end of the injection will be the little bit of air that's left in the syringe. Okay, so this is a little procedure video which will show you how to put it all together. Okay, so we're going to start by trying to define the suprapatellar pouch here. If you look at the ultrasound there, Ryan's going to contract his knee. And you can see I need to come closer to the patella. That's the patella, before I get a good pouch there. So I've got a good suprapatellar pouch. I'm just above the patella here. And I'm going to numb here. I'm going to feel a little numbing poke. From the lateral side. And I'm just numbing right up to, since I have 1% lidocaine, I don't want to get that in the joint. I'm going to go ahead and just numb up right up to the soft tissue. So because we moved it around a little bit with the initial contraction, you can see I still have a pocket without his contraction, so I'm not going to have him contract. You could have him contract if you couldn't see a pocket. My experience is it's a little more comfortable procedure without contraction if you can do it. I've also numbed the track here. And then I'm going to come in from the lateral side just underneath my probe. And you're going to feel a poke here, Ryan. And then you can see my needle right on the screen there. I'm going to come right into the suprapatellar pouch. And you can see my needle tip entering the suprapatellar pouch there. And I know I'm in because I just saw, so I'm going to come down a little bit. I still have my pouch, but I just saw that little bit of air that was in the needle rise to the top of the pouch. So I'm into potential space, which is where I want to be. Now I'm going to start injecting fluid. And as I inject fluid, I'm going to advance a little bit more into the pouch. As I start injecting fluid, I want to see it fill the pouch, but I don't want to see it. I do not want to see it infiltrate into the surrounding tissues. Now I've got a very thick liquid I'm injecting, and consequently you can see the liquid here a little more than you could with other types of injections. But again, I don't want to see it infiltrate into the surrounding tissues, and I want to see the pouch growing ever so slightly. And then that last little bit, you can see there, that last little bit of air that was in the syringe is now on the top of the suprapatellar pouch, and that's what I'm looking for. That tells me I'm in the pouch versus someplace else. So I go below that, I still have the pouch. Right there I see my air, which is blocking my ultrasound signal. and then above that I still have a little bit of a pouch. And that's that. So here is the general step-by-step injection instructions. You can print this screen and obviously put those up in your injection procedure suite if you'd like. And injection pearls. Have patient contract the quad. We've talked about that. Less pressure on the probe may make the pouch visible. This is pretty critical. If you put too much pressure on the probe, you can get rid of the pouch. So if you're not seeing a pouch, let off on the pressure and you may see one develop. Moving closer to the superior patella usually exposes a small fluid pouch, even in normal knees. So there's a little bit of fluid up there. So that's kind of really the sweet spot of where you want to be. Make sure fluid, again, is flowing intra-articular and not into the surrounding tissues. Needles are generally 22 to 27 gauge. I usually try to use a 27 gauge if I'm doing PRP, a 25 gauge if I'm doing bone marrow. And inject very slowly. Injection pitfalls. Anything other than a smooth flow is probably not in the joint. If it's a painful injection, again, you're probably not in the joint. Don't inject high-dose corticosteroids into joints. That's bad form and probably going to be malpractice here pretty soon based on the peer-reviewed literature showing that it helps destroy cartilage and it doesn't work all that well. Brushing against the periosteum of the patella will be painful, so stay away from that area. And what do you do if you don't have a small effusion as an easy target at all that you can find? You can come in lateral patellofemoral, and there's a video we have on that. It's a whole separate video on that within this basic level 1. Or plan C, you can come along the medial femoral condyle, literally touch the medial femoral condyle very gently with a 27 or 25 gauge needle, and there's a separate video on that topic as well. So thanks for watching. There's lots of other videos in basic knee level 1, intra-articular, interfluoral guidance, tendon procedures. I talked about the patellofemoral, different ways to get in the joint, etc., etc., etc. So thanks so much for watching and have a great day.